Welcome to the Auburn Medical Group YouTube live stream, the entertaining medical live stream where viewers can ask real-time questions of real medical doctors. And here are our hosts, Dr. Mark Vaughn and Dr. Gwen Vaughn.
And it's time for the Auburn Medical Group live stream with Drs. Mark Vaughn and
I'm Dr. Gwen Vaughn.
And we're talking today about when the doctor is sick. That's why I'm wearing a mask. And I'm trying to get as far away from Dr. Gwen.
How far can I go?
And still do the show.
And still be in...
in the frame. I don't think we can get the 6 feet that's recommended or used to be recommended.
I don't think you'll hear me if I'm that far away.
So what happens when the doctor gets sick? We'll jump right into it. We'll get to your comments and questions because I can see when they come up. So we'll share those. So I guess I should give some background.
What happens?
I believe Dr. Gwen and I have both had COVID.
Oh, yeah.
I've had it twice.
I've only been diagnosed once, but it's been through my house 3 times. The second 2 times I did not
like
get
many
it.
people, there may have been another occurrence that didn't get tested somewhere along the way.
Yeah.
So when the doctor gets sick, this covers so many things. I mean, we can talk about
so many things.
Respiratory infectious illness like I have right now, and that's why I'm wearing the mask.
And I appreciate that.
Yeah, but I'm gonna turn this way.
Please turn away if you're gonna drink
and have my Dutch brothers. Thank you to our people on Patreon, which, by the way, you too can help. My mask is always crooked. My wife hates it when my mask is crooked. She always corrects
crooked mask.
Crooked mask. Your mask is crooked. Your mask is crooked.
You're so frumpy.
I don't wear a tie, so I have to have a crooked something.
Crooked tie? Crooked mask?
Yeah. Straighten your mask.
Yeah.
So doctors can get sick any number of ways.
What?
It can be infectious. It can be, what have we seen? It's not just the doctor. We'll expand it to the doctor's family a little bit.
Injuries.
Here too, people wonder about that.
We have injuries.
I think we have a video of me sewing up your finger.
Oh, yeah.
Or thumb.
I was talking about, I think both of us have seen each other with thrown out backs at some point in the office.
I don't remember you, but I remember, my back.
I remember yours, yeah.
It's not fun.
Yeah.
Yeah, but it gives you this ammo, though, that healed up very nicely. I can't even see a scar.
Yeah, look at that.
Very good. And some people saw that video where I sew it up.
Mm-hmm.
Yeah, that back going out, oh, man. What I came away from that with was when people come in with back pain, I can both have empathy and not.
I've been through this. I remember it through rose-colored glasses.
I can have empathy.
It wasn't that bad.
And that, yes, this is annoying, and it keeps you from being able to do stuff. And I'm going to take that off because it's kind of distracting with the thing going across the street.
Yeah.
You can get on Patreon at the end of the video anytime. You can super chat now if you want. So, yeah, with the back going out, I certainly empathize. I know what it's like. I know it's a pain. But I also know that most musculoskeletal low back pain does get better with gentle activity.
You didn't go get an MRI?
An MRI. Yeah, we should go over what the doctor doesn't get that's been ordered for him.
That's true.
Too.
What did you not take with this illness? No antibiotics.
No.
You're
actually,
going through
right now I'm feeling pretty good.
Symptomatic treatment. That's what you've been doing, right?
Yeah.
What you recommend to your patients, which is Tylenol and Mucinex?
The same thing I recommend. And
what?
And that's one of the things
follow your own recommendation.
The patients call up on or write on My Health Online, our chat with patients, asking for a Z-Pack.
Yeah.
I have some, and they may not even tell you what the symptoms are. They'll give you a diagnosis.
Yeah.
I have a sinus infection. Send me a Z-Pack.
Describe your sinus infection. Oh, that sounds a lot like a cold.
Well, over MHO? No, that's a visit.
Yeah, it should be.
We actually charge for our services. Surprise.
Yes. Yeah.
So, we're not concierge to that extent.
Yeah.
So, there are people who have bacterial infections and need antibiotics, but we practice medicine to discover that.
Right.
Same thing for urinary tract infections.
Right.
I have a urinary tract infection. Give me antibiotics. Well, how do you know it's not
what are your symptoms?
Interstitial cystitis.
Maybe
well, what's
we should
that?
test that urine.
Well, That's what you might have instead of a UTI. That's what that is. We don't treat with antibiotics.
Right. So and then when you had back pain, you knew that 90+% of those are going to get better in 4 weeks. So you gave us some time. We got better in a few weeks.
Actually, it took me a couple months.
Oh yeah, that one was long.
It was long.
You even went longer than that.
It was long, but it did with gentle activity.
And you didn't have any
walking around,
flags.
Moving.
So
yeah, I did what was recommended. Did the PT, and it went away. So right now, upper respiratory infection. Certainly, first thing. Test for COVID and influenza.
Yes, we do want to know those. And we do have treatments for those if we catch them early enough. That's
And if my Centaur score was high enough.
With a sore throat.
Check for strep because there was a sore throat to it.
Yeah.
But my Centaur score was so low.
And we wouldn't even
that we wouldn't
check.
We wouldn't test.
Yeah.
So so that's why only the influenza A and B and the COVID tests were done, which all three were negative. So it still could be RSV, I suppose.
There are plenty of other bugs going around.
Plenty of other upper respiratory infections.
Which are viral.
Coronaviruses, non-COVID coronaviruses, paramyxoviruses, I believe is one of them. Rhinoviruses.
Yep.
What's another one?
Oh, gosh. You're going to have to test all my viral knowledge.
Oh, there's one I'm trying to come up with. It's a common...
Para-influenza?
Para-influenza. Oh, that's good. Thank you, Patreon supporters. Thank you. They're the ones for the cost of a cup of coffee a week.
You can support.
You can contribute to the delinquency of a doctor. I call it coffee. I have a friend who has a coffee shop. Actually, I should promote it, shouldn't I?
Sure.
Go to the Fig Tree in Roseville on Vernon Street. And he knows I like Dutch Brothers, even though
it's more convenient.
He owns a coffee shop. That's right. It's more convenient than Roseville. And he calls it, he says, that's not coffee. That's coffee flavored ice cream.
Pretty much. It's heated up though,
So I did the testing.
Yep.
I've been treating, had a bad weekend. Like sleeping during the day. I don't do that. Like for hours sleeping during the day. So I was sick. And then miserable nights, some coughing. Mucinex DM does a good job for that. I probably sleep better with the Tylenol that I take at bedtime. Noticed that when I did that, it seemed to be better than when I didn't take it. And then after the weekend, I feel like I'm getting better.
Right. You were scheduled with patients today. How'd that go?
Oh, yeah. Let's talk about that. So because I'm symptomatic, we contacted all the patients on my schedule ahead of time and gave them the option to either reschedule or do telemedicine. We really shouldn't have made the telemedicine an option. We should have just given them an iPad and put them in a room.
That would have been a way to do it.
Yeah.
I could have gone and done your exam for you.
Did you know that? Here, look.
I have a chip.
No, don't do anything. I want to show everybody on. Look at Dr. Gwain's nose.
What's wrong with my nose?
Can you see it? That's on your nose.
Did I get that on my nose?
Where they wrote the type of drink you have.
Oh, look at that.
The ink got on your nose.
I was really, really into that. It was so good.
You black noser.
Is it really on my nose? Oh, wow.
All right. I need to go to the comments here for a little bit. But we still have more to say about the doctors. Oh, no. This person says doctors aren't immortal. What?
With a slightly smiling face.
Slightly smiling face. Okay. And Rusty B is out there. We recognize you too, Rusty, that you're out there. Doctors aren't immoral. No, that's true, VM. We're not. We also get sick. So when it comes to our family, or I'll finish up with myself. So let's say I did have some, we didn't explain what the Centaur score is.
Oh, sure.
When we're deciding whether to test or treat for strep throat for somebody who has a sore throat, we have a scoring system. And it has questions about the age of the patient, whether or not they have, is it cough or rhinorrhea or both? Runny nose.
Yep. Mm-hmm.
Fever, swollen lymph glands.
Lymph nodes.
And
then
swollen.
Purulent tonsil.
Purulent tonsils.
Yep.
Yeah, meaning pus on the tonsils, you can see.
Yep.
And so that scoring you can come away with a less than 5% chance of having strep.
Yep.
Recommend not test, I believe,
test,
or maybe it's optional.
I think if it's that low, you're not supposed to.
And if it's higher than that, they say, yeah, go ahead and test.
Do the test, and then
I think if
it's the highest,
if it's a full score, they say don't even test, just give it.
Treat.
But we can't because of how somebody else scores us.
Right.
People with this logo know what I'm talking about.
We still
we have to test. So we have that available. If I had something that would require an antibiotic to be prescribed for me, I would not prescribe it for myself. Many states have in their medical boards I'm not going to say a prohibition, but maybe it is in some states, but a strong encouragement not to treat yourself, close family members,
right,
close friends. I'm not exactly sure how it's worded, but I think it is for close family members and friends both.
Friends aren't even really a consideration for me. Like family's maybe the only one where I'm
if you had them though.
Yeah, if I had friends.
Yeah. So if it came to antibiotics, I probably would be okay with one of the other providers in my own office.
We've done that.
Yeah,
I think we've seen each other's kids.
With that sort of thing.
Each other's family.
Kids, we even have done suture repairs on our own kids.
Yeah.
Which I think last time one of your kids needed it, we came in on the weekend, and I gave you the option of, hey, if you want me to do it, I can do it. If you want me to assist, I can assist.
Right.
And you chose to do it.
Yeah.
Yeah. So a simple little simple laceration on the extremities or forehead that kids get. We have both done our own kids for that. But if it was, if there was loss of consciousness or suspicion for
a break or need
a broken bone, at that point, I guess we get x-rays on our kids.
I was just going to say, I haven't ordered x-rays for my kids.
I remember getting them for Ethan. But it's just
then it's a external evaluation of that x-ray, have somebody else look at it.
Right. We don't take it upon ourselves to read it. Yeah. So we do a little bit within a certain controlled range for ourselves or for our family members. I don't know. Not much for myself. I mean, with this testing and treating with over-the-counter agents, is that really...
For really mild colds, just...
I don't think the state board has a problem with that.
I don't think so.
But anything beyond that, then we go, that's... we've actually seen situations where a physician is treating a close family member or spouse.
I think I know who you're talking
with
about.
controlled substances.
Yeah.
That
should not be done.
That's not cool. Yeah, we've seen other situations where that was put to an end too. People had action taken on their licenses.
Yeah.
So that's kind of where it is with doctors getting sick.
I have found that, maybe you can speak on this too, but when you are treating your family, I'm not as objective. Like when my kids are sick and I need to look on them, usually I err on the side of, you're fine.
You're probably right.
You don't need anything. But even if they injure themselves, so it's good to get a second opinion by somebody else.
Yeah. But here's something interesting. That's coming from a doctor, but yet we hear about other people who are in the medical field, or maybe it's people when they're starting out in the medical field, who see the absolute worst possible outcome in everything. Yeah. And everything's the most extreme and most
catastrophize.
Yeah. Is that just
maybe is that just because I had those
is that personality or is it
in my medical
or is it
school
experience
too?
Or yeah,
I'm sure you had this. Like going through medical school, you had that one student who every time you learned something new, they had that condition.
Actually, I didn't, but I know the type of personality you're talking about.
We had a few.
But I'm thinking, is that so much a physician thing, or is it like people with lower levels of training in medicine?
Sure,
who do hear the exposure to these things, but don't have the perspective.
Sure.
One of the things that we have is perspective. So. In primary care, more so than in specialty care, you'll notice that there's actually differences in ways that things are approached based on the chief complaint or presenting problem. A family medicine doctor might approach it differently than a specialist would. And that's because we see all comers. And so we know what the less serious, more mild type of thing is, whatever the complaint is, whether it be respiratory infection or a broken bone. And so we take care of those things. Mm-hmm. We protect the schedule of the ENT specialist or something else. So they don't see everyone. So they might have a more, shall I say, comprehensive approach in their workup of something than we would.
Yeah.
Because they're getting more serious things with more potential for complications. Do you know what I'm saying?
Sure, yeah.
They see a different view. We see the whole pie. They see the little segment that has to be referred to them.
And usually those are the ones that are more sick, more complicated, needing more tests, needing more
And so they're used to people that are kind of more at the extreme.
Yeah, right.
Okay, back to your comments and questions, because we can do that here. Because we're live.
Interactive.
Cool. Make sure you hit that bell icon when you subscribe so you can participate in the live discussion. Rusty B. Here we go. Rusty B. If you treat family, how does insurance pay? Good question, because that's what matters.
Because, how do I get paid for this work I did?
So, answer that question.
They don't? Because I don't bill for insurance? Because I would be the one.
Did you hear this case where a guy was in a small town? I believe he was an oncologist in a rural area. So he was the only one around. And it was one of his parents who he was actually treating.
Oh, wow.
He could not get paid by Medicare.
Because it was his family?
Mm-hmm.
Really?
Yeah.
Wow.
It's a story. Can't give you a reference, so take it for.
Yeah.
But it is something I remember reading.
I mean,
it was like in one of those FFAP articles, or or throwaway something about.
Yeah, I mean, since I'm the one providing the service, then I'm not gonna charge for my family. And
I think the insurances have rules against that.
They
too.
probably do. Yeah. And I'm not, the way our insurance works, we have an HMO where there's my family has a primary care provider, so they're supposed to get their primary care through that primary care provider, not me.
And that insurance program that you're in a SIP program.
Mm-hmm.
So we're in a program where the doctor's getting paid monthly, just like we do for our patients through that program.
Capitation.
Whether you see them or not, you get paid.
Yeah.
If you see them a lot, you don't get paid more. If you see them a little, you still get paid the same amount. So, but a suture repair, that's on the carve out. So that would be something that the doctor could bill for, but I don't know if our insurance would pay us for it.
I have not billed for any of those. We do make sure that we document all these things because that is a requirement.
Yes, we do.
Of the license, the California Medical Board.
My testing is documented in the office.
Yep. Whenever we test each other, that goes in there.
Yeah. There's a record of all the testing that's done.
Mm-hmm.
Okay. If there's not any further questions or comments, we'll stop exposing Gwen to whatever it is I'm getting over.
Oh, I thought you were going to say my black nose syndrome.
Do you keep touching that each time you drink?
I think so.
It's
rubbing off.
Can you see the?
See, your nose hits that too.
I wonder if I could get
Mine
that.
Is just right where the writing is.
Let me see if I can get that on your camera. About where it would be in focus. Can you guys see right there how there's a little reflection right where my nose hits it, my skin oil?
You're all in.
There it is. There it is.
We are all in when we drink these. Bottoms up.
Again, thank you to our Patreon
nose
friends.
To the cup.
Nose to the cup. We're serious about our Dutch brother. Okay. So wait. Wouldn't you know it? Lindsay jumps in. Finally.
Thanks for
Here's Lindsay's comment.
Showing up.
So Lindsay says, do you judge other doctors' opinions or their recommended course of treatment? Lol.
Absolutely.
Lots of love. All the time.
Absolutely.
Every day. What do you think we're doing when we're talking? Is this
He probably judges mine. I judge him.
How do you know when a doctor is judging the opinion of or recommended course of treatment of another doctor? His lips are moving.
That sounds like a
lawyer joke.
Yeah, lawyer joke that got turned into a. Yeah.
I was quick there. You see that?
I see what you did there.
That's what you guys get for your money.
Yeah, sometimes. I mean, case in point, I see an urgent care doctor who prescribes a Z-Pack for a cold or bronchitis.
Oh, my goodness.
I get a little upset.
Urgent care. You need to know. We're reading the charts.
Urgent care, come on.
If you're watching this, people with the same symbol if you're watching this and you see, I'm leaving her comment up because that's what I'm talking about. If you're seeing my patients and you're just throwing Z-Paks at them,
then they come to me a year later and said, "Oh, that Z-Pak worked great last time."
yeah, because they got better within a couple days, just like they would have if they didn't get the Z-Pak.
Yeah.
Stop perpetuating myths among the public. I'm sorry. We're really picking on urgent care here, aren't we?
They probably look at our stuff and say, "What are those guys doing?"
Not every urgent care provider does this.
Yeah.
But that's where we're seeing it because our patients, the only other place that they see somebody for that kind of thing is urgent care because we take care of it if it doesn't happen on the weekend or that afternoon and they have to be seen and we don't have a slot for them that day.
Right.
But otherwise, we try to take care of it in-house.
There you go.
We try to take care
saw
of it.
judging in action there.
There you just, Lindsay, you sparked a great segment of the show. Judge this.
Judge this.
We should have a graphic come up. Judge this.
You know what time it is.
You know what
that
time it is.
of the show where we judge other doctors.
Let's do that. Let's totally make that a regular segment.
It's a regular segment.
It's time for...
We're going to bring up...
Judge this.
Who's the specialty of the day we're going to judge?
That's right.
Cardiology.
Today's cardiology.
Oncology. Oh, that would be too easy.
So...
Anyways.
Okay, would this be considered decreasing the public trust in the profession? Why do they...
He's going to go anyway. I don't think you were waiting for my answer there.
Why do they nail the tops of coffins?
Oh, gee.
To keep the oncologists out. How can you tell an oncologist at a funeral?
They're the ones doing CPR.
They're the ones doing chest compressions.
We love our oncologist friends.
Oh, we are going to give you a good show until I lose my license. So enjoy. Come back every week. Thank you, Lindsay, for asking that. That was good. Until next time.
All right.
What?
Yep.
Until next time.
I'm Dr. Quain.
And I'm Dr. Mark Vaughn. Thank you, Lindsay Antwine, for what you do on Patreon. Everybody else you can get on Patreon, too.
Bottoms up.
Until next time, stay in good health.
Doctors, thank you for another informative session. Auburn Medical Group is located in Auburn, California, USA. Thank you for participating. Please tell a friend and join us again next week.